50-year-old Samuel Njoroge lies on a hospital bed, his arm suspended in the air.
Nilianza kusikia uchungu, sana nikaanza hata kuinua mkono, kuwa na shida.
Njoroge has not been at work for 3 days now. He is currently recuperating from a surgery on his elbow, known as elbow arthroplasty.
You have to elevate the arm to reduce the swelling and the pain.
If inflamed, it can cause hampering of the activities of daily living, like having food, for hygiene.
Njoroge serves as a supervisor in the environmental department of the Nairobi Metropolitan Service, NMS. He suffered from inflammatory athritis, a rare condition that paralyzed his right elbow.
Sasa kazi yangu sikuwa nimesimama, nilikuwa naendelea. Lakini wakubwa wangu walikuwa tu nipea moyo tu nifanye tu. Kazi ya sometimes kuandika na kuongea na watu.
He says the condition began while he was at work and gradually worsened. Njoroge, unable to travel to India for surgery, has opted to have it done in Kenya.
Nilikuwa naenda hospitali zingine wakugundua. Walikuwa wananipea painkiller peke yake.
These patients present with pain, but they don't get exact treatment.
Dr. Kartikeya Joshi is an orthopedic consultant at Medihill Group of Hospitals. Together with a team of experts from the hospital, he conducted the surgery on Njoroge, a first in the country.
He was having a lot of pain, and for almost few years he underwent medical treatment. He took medicines, physiotherapy, but to no avail. So we opted to plan for a total elbow replacement.
Dr. Joshi goes on to elaborate the difference in effects to the joint when it comes to inflammatory arthritis compared to other forms such as osteoarthritis and post-traumatic arthritis.
In this, it affects the joint in the form of there's an increase in vascularization, they're followed by synovitis, it causes destruction of the joint, and the ulnohumeral, radiohumeral joints and the proximal ulnar joints are affected, leading to pain, swelling, restriction of movements, and they finally lead to ankylosis, or it may fuse also.
Back in Njoroge's recovery room, his nurse, Betilin Marangu, is attending to him. She narrates to us her experience dealing with a patient presenting a rare condition, which in this case was a first to her.
He always calls us when he needs us, and you're always here when he needs assistance with anything, everything, ambulating from the bed, receiving the phone, feeding. We're always here to help him whenever he wants. When the patient needs to be moved from the bed to the washrooms and stuff, so we're always here to help him do that.
Njoroge, who was at risk of having his right arm amputated, is no longer living with fear of the unknown. The surgery, which costs approximately 400,000 Kenyan shillings, is however not necessary for all patients.
We always start with physiotherapy and medications. Medication to relieve pain, to give muscle relaxations, to treat the inflammatory arthritis. They have a different set of medications which are given. If not treated properly, if a patient has severe combination of the joint because of the fracture, post-trauma, they can have this problem.
Ben Kirera, K24, Weekend Edition.